What role do delayed hypersensitivities play in eosinophilic esophagitis?
Oh, no, that's an interesting question. Eosinophilic esophagitis is getting to be more common. It is considered to be an allergic condition, although generally when we say eosinophils, we're talking about the type 1 reactions, the histaminic reactions, the immediate immune reactions, the so-called type 1 reactions. That's where basophils, eosinophils play an important role. What we've observed, and these are colleagues who have had cases of eosinophilic esophagitis, is that if you follow the LRA by ELISA ACT tests for delayed allergies and implement the plan to restore tolerance in the immune defense and repair system, very often the person reports that the type 1, the histaminic seasonal allergies, the degranulation reactions that lead to hives, wheezes, itching, anaphylactic shock, and eosinophilic esophagitis, resolves when you restore tolerance in the delayed immune system because you've reduced the burden, you've enhanced the detoxification system, you've enhanced and topped up the essential nutrients based on individual need. And now the body can restore not just delayed allergy tolerance, but even type 1 histaminic reactions, seasonal allergies, and or eosinophilic reactions all over the body, but especially in the esophagus, resolve. They just go into remission. I think the risk remains the person needs to stay on an immune tolerant diet. They need to eat foods they can digest, assimilate, and eliminate without immune burden. They need to take in the essential nutrients that their body needs to repair them. And they need to pay attention to what they eat and drink, to what they think and do, because it all contributes to how your immune, neurohormonal, and repair systems operate, how efficient or inefficient, how effective or ineffective they are. So while it sounds like the answer is antihistamines, that does not usually help eosinophilic esophagitis or any of the eosinophilic conditions. What does seem to help is recognizing how important it is to eat the foods that you can break down to their elemental building blocks, take them in, utilize them, and eliminate them without immune burden. So the LRA by ELISA ACT tests and the other predictive biomarkers are especially helpful in cases such as these. From what I'm hearing from colleagues, this is no longer such a rare or exotic condition. And so I think this is something that functional and holistic and comprehensive care clients and physicians and colleagues should pay more attention to the possibility that when someone has a swallowing issue, it might actually be esophagitis. It might actually be a chronic repair deficit with eosinophils prominently present, indicating that the immune system is reacting. And we want it to be tolerant, not intolerant. We want to be able to take in the foods that people can digest, assimilate, and eliminate without immune burden. We want to know whether we're at risk for the other predictive biomarkers in terms of being at the goal value, which means your body is most able to repair itself. Or if we're not at the goal values, what can we do in a few months to bring ourselves to or back towards the goal value, adding life to years and years to life, adding quality to daily existence, and having conditions like eosinophilic esophagitis go into remission spontaneously.